So we always ask, is water the best solution to all of our problems? Because we want a good solution, right? We want to get our patients better. And the thing is that hydrotherapy as a field in of itself is a great utilization for many aspects in rehab. That may be the neurological patients, that may be the post-surgicals, the osteoarthritic ones, and the obese ones, right? Because what are all of these patients fighting? They're fighting gravity. So when we have buoyancy of water in a controlled environment, and that's the big key here, we have to have a controlled environment. It's our type A personalities, we don't want infection, we don't want patients to get hurt. We want to have a nice, safe environment where we can work against gravity. The best and most efficient way to do that is with an underwater treadmill. It's a dry chamber, pets go in, very easy acclimation, so I can control the temperature of the water, the pH of the water, I can control the speed of the treadmill and how high that water is set to that patient. And we've actually looked at this. So if you take a 100-pound dog, when the water's up at the level of their hip joint, that dog only feels like it weighs 38 pounds. Okay, so think about those older German Shepherds with degenerative myelopathy that are just having a really hard time getting around, or those morbidly obese golden retrievers that have arthritis in their elbows and their stifles and their back. So now we have this ability to get these guys moving. And the benefits of the water is not just the movement, but we want to think about the hydrostatic pressure on them, so it gets them a better sense of proprioception and their ability in space. And those patients that are wobbly on their feet, that are a little ataxic, well, the water keeps them in a more of a neutral position. They're always getting neurosensory feedback into that, and now we can get them moving. The other way we get to work with these that's critically important is with our sporting and working dogs. So underwater treadmills, again, we have all those safety factors that we've got controlled. They're not out in a pond, they're not out swimming with alligators or doing other silly things, but we can now condition our athletic patients to keep them in top physical condition so that they're able to serve, to protect us, to do all the wonderful things that working dogs do in all lines of duty. We can now keep them in good shape. So for patients out there in general practice, these are the things that are not just going to be at specialty practices. I can't see every patient that has arthritis. I'd like to, but I can't. We want to have a big, good team approach, and there's folks that are not going to be able to drive to specialty hospitals. So for folks to have underwater treadmills in, it's a profit center. You can work on all your obese patients. There's multiple journal articles out showing protocols on how to get obese patients to lose weight and have better body condition using an underwater treadmill. And then all of those patients that have some arthritis, that have neurological problems. And then if you're working with sporting and agility and field trial dogs, here's a safe way in off seasons, whether it's too hot in the summer or too cold in the winter, for them to keep in good condition. So this is a great avenue to add into your practices.